Assalamu alaikum wa rahmatullahi wa barakatuh. Yet viewer, our esteemed viewer, we are back with your most cherished program, that is the Health Check for You, a program where we give you medical advice from different medical experts. And today we are discussing eye injuries and traumas. And with me is Dr. Herbert. He's been our colleague for quite some time. He's been visiting us. He travels almost 300 kilometers to come and give us some assistance that we assume you need, our viewer. Dr. Herbert, you're most welcome.
Thank you so much for having me.
Later on, online, we have two medical or eye specialists from Mbale Hospital. That will be Dr. Busonya Hamza and Dr. Simon. Later on, we shall be joined by Dr. Simon Mozito. And right now, I'm going to the panelists with me today, who is Dr. Herbert. Before we join our brothers in, I would like you to explain to our viewer what eye injuries and traumas are before we call in our brothers.
Yes, thank you very much. So today we are discussing a topic that is trauma to the eye, or traumatic injuries to the eye. Now, these injuries range from about three things. We have injuries that are penetrating into the eye, which we call penetrating injuries. We also have injuries that do not penetrate the eye, but they affect the eye. Those injuries, we call them blunt trauma. And then we have injuries that are caused by chemicals, which we call chemical injuries. So anything that, that comes with a force and hits the eye to cause injury, we call it a traumatic case of an eye. It can be a penetrating object, it can be a blunt object, or it can be a chemical. Yes.
Okay, thank you so much. So you've talked about two main types of...
Yes, three main types.
Three main types.
Yes.
Thank you so much. At this very juncture, I would like you to explain to our viewer those types and what causes them. Can you expound a little bit further?
Yes, that's right. Thank you very much. Now, I'll talk about first and foremost about chemical injuries. Chemical injuries, we have about two kinds of chemicals with different pH levels. We have chemicals that are acidic, and we also have chemicals that are alkaline in nature. Yeah, so people work with different chemicals depending on their occupations. Like farmers, they work with pesticides, they work with fertilizers, and other chemicals that they use during their farm work. And then we have people who work in laboratories dealing with chemicals directly every day. People who work in industries and that manufacture different things, they use different kinds of chemicals. Now, we have seen very many kinds of injuries that are happening due to these chemicals. And some of these chemicals, like I said, they are acidic and others are alkaline. But the most feared chemicals are the alkaline chemicals, because their nature of the way they affect the eye, they penetrate into the eyeball. And if it penetrates into the eyeball, then it can destroy all the other tissues inside the eye.
So our brothers that work in pharmaceutical companies should pay heed to this.
Should be very careful. They should wear their protective gears, like those protective goggles, in case there's a splash of a chemical, your eyes are protected. Yeah, so chemicals to fear, all chemicals should be feared to have contact with the eye, but especially alkali chemicals, like those that they use in fertilizers, in pesticides. Those are very, very dangerous chemicals, and some of the chemicals that they use in the laboratories. So you have to be very careful if you are dealing with chemicals. You have to wear your protective gear, especially the goggles to protect your eyes. So that is just simply a brief about chemical injuries.
Chemical injuries,
yes. Then we have blunt trauma. Blunt trauma, these are these are injuries that can happen to your eye, but do not penetrate directly into the eyeball. For example, you are playing a football match and they hit you with a ball. Someone has maybe kicked the ball and comes directly to your face and hits one of your eyes or both eyes. Yeah, such a kind of injury is called a blunt trauma. Maybe you are having a physical exchange with a friend or anyone, you are fighting, and they hit you with their fist to the eye. That kind of injury is called a blunt trauma.
Okay.
Yeah. So these injuries are also to be feared because they might not penetrate into the eyeball, but because of the force with which it has hit the eye, that force can go up to the back of the eye and also cause very many injuries inside the eyeball,
Okay.
like retinal detachment, cataracts, and other things.
One might
Hemorrhage,
be walking,
yes.
moving on a motorcycle, and then an insect.
Yes, an insect flying at missile speed,
yes.
comes and hits the eye. So you can have a bleeding inside the eye, you can have a detachment of the retina, you can have a cataract caused because of that injury,
Okay.
a blunt trauma.
Okay.
So that injury is also to be feared. And if you get such injuries, the first response is run to the hospital. And a person who gets a chemical injury, the first thing that you should do is to wash your eyes profusely with water. Wash your eyes before you even run to the hospital. If you have a chemical splash in your eye, go to where there is running water, a tap, open it, put your eyes, let water run in to dilute that chemical as much as possible before it affects the eye even the more.
Okay.
Yeah. So the other type of injuries is penetrating injuries. These are kind of injuries that we see in road traffic accidents, in some of the gender-based violence. Someone gets a knife and pokes your eye, penetrates into the eyeball. Others, sometimes also on occupational hazards. You are working on a site, you are an engineer, site engineer, you are a mason, you are a builder, and a nail pokes your eye and penetrates into the eyeball. Those are penetrating injuries. I have seen a case where little children in a school were fighting with each other, and then poked a pencil, and the writing part, the sharp part of the pencil broke and entered into the eye.
Okay.
Yeah, so some of such injuries we should avoid. Children playing with sticks, sharp sticks while they're at home, they might poke each other's eyes and the injury penetrates into the eyeball. Yeah, so some of those are the types of injuries that we are talking about, traumatic cases of the eye.
Okay, thank you so much,
Dr.
Hubbard. At this very juncture, we have our brothers that I initially introduced at the beginning of this program. That is an eye specialist from Mbale, our brother Simon Muzito and brother Hamza Busonya. At this very moment, I'm going to invite Dr. Simon Muzito to help us. You have talked of different types of injury or trauma cases.
Yes.
So I need Dr. Hamza, Dr. Simon to help us with the types of treatment in case one gets these kinds of injuries, and if it is preventable, give us some advice on how to do it. So Dr. Simon, we are at you now. Give us some prevention measures and treatment. How do you treat these injuries?
I greet you all in whatever you are doing and whatever you have done. I am Mr. Simon Peter, an ophthalmic clinical officer. Today I want to talk about ocular trauma or trauma to the eye or injuries to the eye. Ocular trauma has become a serious incident at the facility. Trauma to the eye or ocular trauma means any injury can be chemical or mechanical to the eye. With chemical injuries can be caused by acid or alkalis getting in contact to the eye. Then with mechanical can be blunt trauma or penetrating injuries to the eye. Now with blunt trauma, you can get injury to the eye by a mechanical object, but when there is no penetration into the eye. With penetrating injuries, those are injuries which happen onto the eye and they enter into the eye, or they cause injuries to the intraocular structures. Penetrating injuries can be caused by sharps like a stick, pencils, pens, knives, those sharps which can cut the eye and get access into the inside parts of the eye. With blunt trauma can be by a blow or something blunt and can cause laceration to the eye. With chemical injuries can be by acid or alkalis falling into your eyes. These ones we consider all as emergencies and they need emergency attention. The most common age affected, they are these young ones between below 13 years, because those ones they give less care to their eyes sometimes, and they usually play with sharps. That's why it has become a serious incidence among that age group below 13 years. Among the common cause, some parents bring their children complaining that they were playing with the pencils, with a knife. Some were grazing animals, and so something hit the eye and caused penetrating injuries. The advanced treatment about these injuries. With chemical injuries, we do immediate copious irrigation of the eye with running clean water for over 30 minutes when we are irrigating the eye with clean water. With these injuries, with mechanical injuries, the best treatment is surgery to remove, if there is something retained into the eye, to remove that foreign body. If there is blood, to do hyphema washout or blood washout from the eye. If the lens got damaged, can do also lens washout and repair the part which was damaged. It can be when it went through the cornea or through the conjunctiva, that part has to be repaired. Then can give treatment like intravitreal, if it got access into the vitreous, can give intravitreal treatment like vancomycin. If that injury damaged the eye and did not enter into the eye, we treat with topical antibiotics, give some atropine, depending on the cause, can include even an antifungal. That's the best treatment. Then when injuries happen in the community, there should be immediate referral to the eye facility. And with penetrating injuries, we are not supposed to put any eye medicine into the eye, because some medicines, some drugs are pro-drugs. They get activated when they reach that side. Now, if we put the medicine, we just enter into the eye, and some medicines are retinotoxic. They are toxic to the retina. That's why we encourage not to put any medicine to the injuries which are penetrating into the eye. That's the best treatment for injuries. Chemicals, chemical washout, copious irrigation of the eye.
Okay, that is Dr. Simon there for you. Thank you so much, Dr. Simon. We hope next time you join us again. When an invitation comes in, please don't deny it. At this very moment, Dr.
Yes.
Herbert, I'm coming to you. There are some myths that I would like you to talk about regarding these these types of injuries
Yes.
to our eyes. What are some myths? Some people might think some injuries are incurable, some are curable, some do not need medical attention.
Yes.
So I need you to tackle such myths, and after that, I think you tell us or give us advice to our beloved viewer there who take self-medication
Yes.
after inquiring such injuries.
Yes. Now, the nature of these injuries and all kinds of injuries of the eye should be managed by a professional, a health professional,
Okay.
and specifically a person who is a specialist of the eyes, because of these very many reasons. Many times when our patients get these kinds of injuries, the first thing is to look for any nearby drug shop and buy an eye drop, maybe to relieve the pain, because it will come with pain, the injury will come with pain. They'll go, give me pain, I've got this injury, maybe an insect has fallen in my eye or a chemical has splashed in my eyes. Yeah. So some of the eye drops that they buy or get or self-medicate with themselves with, they are in a class of drugs that are dangerous sometimes to those eyes.
Okay.
So if you have a penetrating injury, it's not advisable to put any eye drops until the part that has been punctured or that has the part of the eye that has been torn is repaired. It's not advisable to put any medicines, okay?
Yes.
Because these medicines are toxic to the inside tissues of the eye. For that reason, therefore, before you apply any medicines, the eye should be repaired, because some of the treatments that we shall give a person that has got an eye injury is surgery to repair where the damage is. So before any eye drops are administered to that eye, the eye should be repaired, such that the inside tissues are protected from the toxicity of this drug. Some drugs are made with additives and preservatives. So those preservatives can be very toxic to the inside parts of the eyes, which are very delicate. So in that regard, in case of any injuries, my first number one advice is that run to a health professional.
Okay.
And if it needs surgery, the surgery will be done. Do not put any medicines to that eye. Do not put any medicine to that eye. The problems that we are facing, some of the problems, people come late. They first use traditional eye medicines. Traditional eye medicines, they use dirty materials. They get plant materials, chew them in the mouth and drop on the eyes, collecting all those germs and putting in that eye, which already has an injury. It has an opening. It has been cut through. If you put dirty things, you're going to end up with a very serious infection that might not be able to recover even while we start on treatment. That's why sometimes the eyes of some people are removed.
Sure.
Yes, because you've introduced infections to that eye, and the infections have multiplied and they are continuing to multiply. The only way to save you is to remove that eye. Yeah, so let us prevent or resist from applying or self-medicating ourselves when we get eye injuries. Number two, some people, when they get injuries, they don't go to the right place. They don't go to the right place. Others go to the local clinics where there is no eye health professional. And then, of course, this professional that is inside there will not be able to tell you the truth because he doesn't know about eyes. Instead of referring you, they might choose to prescribe some medicines. Others, along the way, they continue using those medicines and they don't get help. So the first thing, run to a place where there is an eye health professional, have your eyes checked. If it needs surgery, have the surgery done. If it just needs treatment, get the treatment. And again, just to emphasize, if it is a chemical that has splashed into your eyes, before you even run anywhere, the first thing to do is to find water, clean water, wash your eyes thoroughly as much as possible, dilute that chemical as much as possible, or take it out of your eyes as much as possible.
And if it means deepening your head into water,
into a basin of water,
do it.
You'd rather do that.
Okay.
Because some of the chemicals will not wait for you
to
travel
to
the hospital.
And we know the African setup
Yes.
regarding hospitals and some other important infrastructures.
That's
it might
right.
take you weeks and months, if not years, to reach there.
Yeah. And yet just a few hours with a chemical in your eye will render you blind.
Oh,
yeah. So it is very, very important. If it is a chemical that has splashed in your eyes, find where there is clean water, wash your eyes immediately, then seek help after.
Okay.
Yes.
Thank you so much, Dr. Herbert. That is Dr. Herbert there for you. If you can, please take his advice. If you can't, then you are the one to blame. At this very moment, we have Dr. Hamza Busonya online. Unlike our brother, the first one that we had in the beginning of our program, Dr. Simon, Hamza Busonya is not new to your eyes. He's been regular in our programs, though he has not visited our studios once because of his busy schedule. But whenever we make an online call, he's ready to answer and give us the advice that we inquire from him. At this very moment, I'm going to request you, Dr. Hamza Busonya, to give us some more treatments to these injuries, some advanced treatment. Dr. Simon gave us some, but we need some advanced one now. There are some of our viewers that might require some advanced treatment. So this is why we had to call you in. You're a specialist in trauma injuries or injuries to the eye. So please kindly help us and guide us to which advanced treatments that we need to do to a certain type of trauma or injury.
Hello everyone, my name is Busonya Hamza. an ophthalmic clinic officer. So today I'm talking about ocular trauma or ocular injuries. So ocular trauma or injuries, there are different two types. Ocular trauma mainly means like maybe someone punching you in the eye or getting any physical damage in the eye. Then under injuries, you can have things like chemical injuries and other types. So for ocular trauma, it's so common nowadays, especially in the population, given the mechanism of living, let's say means of transport, the games we play, and different things activities we are involved in. So it is so common, let's say, in the young children who are always playing at schools, homes. It's a common thing in that they can easily hit their eyes by stones or even like through maybe punching or fighting. And it is associated with many eye problems. So in most cases, in patients with ocular trauma, it can be classified into different let's say, categories. We have some kind of trauma that only affects the extraocular parts of the eye, let's say the outside parts of the eye. So in case we can have like maybe damage to the eyelids, like eyelid tears, or we can have damages to the epithelium of the cornea or the conjunctiva, or in cases of some cases of like blunt trauma, let's say with maybe a missile or maybe a fist, we can have damage inside the eye, like there can be bleeding inside the eye, though the damage hasn't maybe perforated the eye, but we can get bleeding inside the eye and also other intraocular complications like hemorrhages in the vitreous, at the retina, and in advanced cases we can have things like retinal detachment. Also, other categories of chemical injuries, we have like rather other categories of ocular injuries. We have what we call the chemical injuries. This can be caused by different chemicals, let's say acids or alkalis when they pour into the eye. And these are always so common also when people who are like working with chemicals, children at home who just pour anything to their eyes. Yeah, and this is always managed in the hospital. Most cases, we first do irrigation, then further management follows up after giving some first aid. Also, we have injuries like the electrical injuries, let's say like electric shock, can also affect our eyes in that, though it may not specifically be onto the eye, but in people with maybe electrical injuries, they can also get eye problems. We also get in cases of like thermal radiations, we also count it under ocular injuries. So in cases of like maybe exposure to radiations can also affect our eyes. So management is always based on the extensive or like the severity of the trauma. So in cases of these extraocular, let's say maybe there is an eyelid tear, they always do like lid repairs. They switch out the eyelid and appose it together. Then in cases of patients who have gotten like corneal tears or conjunctival tears, it's also done by repairing the torn part or the affected part of the eye. Also, in some cases, we can have penetrating injuries whereby there is a tear, and also there's also again intraocular damage like bleeding inside the eye, or even the lens is affected. In such cases, we can always do, if there is blood, we do blood washout, which we call hyphema washout, or even lens washout if there is like much damage to the lens. Then if there is like maybe bleeding beyond like in the vitreous and the retina, we always give some anti-inflammatory drugs. Most cases they are always intravitreal. An injection can be like given inside the eye or retrobulbar, that's behind the eye, to calm down the inflammation or reduce the bleeding to prevent any further complications. Then in case whereby the damage has been so adverse that maybe the patient has gotten, let's say, a retinal detachment, we always refer to a retinal surgeon for further management. Thank you.
That is it from our brother, Dr. Hamza Busonya. Thank you so much. And next time when we call in, please, just like you did today, just like you've been doing, always keep answering our calls for help. Dr. Dr. Hubbard.
Yes.
This is the time we have to call this program to a close, but before we do so,
Yes.
what might be the long-term effects that one might face if he does not attend or if it does not seek medical advice when they get these injuries, eye injuries?
Yeah, thank you very much. Traumatic cases are one of the leading causes of blindness worldwide. And if you don't get help early, definitely you lose your sight because of certain kinds of injuries. Like for chemical injuries, like we have learned, if it penetrates your eyes, sometimes it may not penetrate, but on the surface of the eye, on the cornea, will cause a permanent scar and you'll not be able to see through that eye again. Sometimes people have lost their eyes due to injuries, traumatic injuries, and sometimes the injuries are beyond repair and can't be repaired. But for those that can be repaired, sometimes they recover sight, sometimes they don't recover sight. Some of the traumatic cases, as complications, they'll get cataracts, they'll get retinal detachment. If detected retinal detachment early, it can be repaired and the person can regain their sight. If it is bleeding inside the eye, the bleeding can be washed out and the person can regain sight.
Okay.
If it is a corneal ulcer can be treated and the person can regain sight. So the most important thing to emphasize, please come to the hospital early enough. When you get an injury now, come to the hospital now. Don't wait after a week, don't wait after 2 weeks, don't wait after 1 month to respond. Come early and find professional help always.
Okay.
Yeah.
Thank you so much, Dr. Herbert. For the chemical injuries, he's advised us earlier, please, before you even think of going to the doctor, that is in case the doctor is far away from you, you need to cleanse your eyes with clean water as many times as you can, because chemicals might not wait for you to reach your doctor, but water can help you to get rid of a few of them out of your eyes. I remain your host, Nambale Bashir. Tune in same time next time, inshallah, same day, same time. This program again is going to air on your TV, inshallah. We'll bring you other medical experts for medical advice. I remain your host, Nambale Bashir. Assalamu alaikum wa rahmatullahi wa barakatuh.